Good morning. The Senate Aging Committee will come to order. I'm glad to be here today, and I want to thank the College of Southern Nevada for hosting this important hearing. I also want to thank our witnesses and everyone who's been able to join us here in person, as well as those, of course, watching online. We're holding this morning's field hearing in Las Vegas to discuss a pressing need for Nevada seniors, lowering the high cost of prescription drugs. The past 2.5 years have been incredibly challenging for so many Nevadans, and as we work to finally put the COVID-19 pandemic in the rearview mirror, we must continue to invest in the health and well-being of our most vulnerable, especially our seniors. What does that mean? Well, it means that making sure that seniors in Nevada and across the country, that they have easy access to quality, affordable health care, no matter what community they live in. It means taking steps to address the high cost of prescription medications, including by allowing Medicare to use its buying power to negotiate for lower drug prices. And it means capping out-of-pocket prescription drug spending for seniors on Medicare Part D. Medicare is a sacred promise. It's the promise of guaranteed access to health care after a lifetime of hard work. Despite this promise, we know that many seniors still have trouble affording and accessing much-needed prescription medication. No one, and especially seniors living on fixed incomes, should have to choose between buying groceries and taking life-saving medication. But for years, far too many Nevada seniors have faced this impossible choice. In fact, unfortunately, many seniors ration their medications or skip taking them altogether because of high costs. And we're going to hear real-life stories of this today. But simply put, this is unacceptable. That's why, after nearly 30 years of inaction, I'm proud to have worked with my colleagues in Congress to deliver on the promises that so many have previously made and to finally lower drug costs. We're bringing about real relief for Nevada seniors and seniors across America. And this hearing could not be more timely. My Democratic colleagues and I just passed the Inflation Reduction Act. And just last week, President Biden signed this historic bill into law. This transformative new law will finally allow Medicare to negotiate the best price of prescription medication for America's seniors. The Inflation Reduction Act will also cap seniors' yearly out-of-pocket spending on prescription drugs at $2,000. And it will cap the price of insulin for Medicare beneficiaries at just $35 a month. This new law will usher in an era of increased access to and affordability of life-saving prescription medication for Nevada seniors. And because private insurance often follows Medicare, the new negotiation authority included in this bill could end up lowering prescription drug costs not only for seniors, but for all families. As we prepare for this new law to go into effect, I'm thrilled to have the opportunity to hear from our excellent panel of witnesses today about how the high cost of drugs have imposed burdens on Nevada seniors, how high drug costs impact seniors' health and well-being, how this impacts healthcare professionals and caregivers, and how the new law I helped pass will soon help reduce costs right at the pharmacy counter. I'm also looking forward to hearing about how Congress can best implement this new law and continue our work to lower healthcare costs across the board for Nevada seniors, including through legislation I've introduced. Before we begin, I want to remind the witnesses to please keep their remarks to 5 minutes. And with that, I'm going to introduce all of our witnesses at once, and then we'll proceed to your opening statements. So our first witness, Ms. Maria Moore, who serves as the State Director of AARP Nevada. Thank you, Maria. She's a longtime advocate for the aging community. Ms. Moore previously served as AARP Nevada's Community Outreach Director since 2003. She's also served on several boards and commissions, including the Nevada Commission on Aging, VA Southern Nevada Healthcare System Volunteer Association, and the United Way of Southern Nevada Emergency Food and Shelter Board. Thank you, Ms. Moore, for being here with us today and sharing your expertise with the committee. Next, I will introduce Dr. Christina Madison, a clinical pharmacist and associate professor at Roseman University College of Pharmacy. Dr. Madison also works with patients at, at Hunt Ridge Family Clinic, one of the largest providers of HIV prevention and gender-affirming care in Nevada, and Volunteers in Medicine of Southern Nevada, where she provides immunization and communicable disease care. As a clinical pharmacist, Dr. Madison has seen firsthand the roadblocks that patients experience in trying to access their prescription medications. As an associate professor, she has supported residents and fellows as they begin their own journeys into pharmacy care. Thank you, Dr. Madison, for being with us today and sharing your expertise with the committee. Our next witness, Mr. Jeff Klein. He's president and CEO of Nevada Senior Services. Nevada Senior Services is a healthcare organization that works to find ways to make healthcare more affordable and accessible for seniors all across the Las Vegas Valley. Prior to his service at Nevada's Senior Services, Mr. Klein founded Altila Associates, where he conducted and supervised extensive engagements for hospitals, medical groups, and academic centers. He has also spent time in healthcare leadership and hospital management in New York State. Thank you for being here and sharing your expertise with us. And finally, our next witness is Ms. Regina Milner from Las Vegas. Ms. Milner, well, she's a patient advocate and Medicare beneficiary who personally knows the struggle of managing multiple health conditions and affording her many medications. She will share the stress and the burden that she's faced during her own health journey to access life-saving insulin and the other medications that she needs. So thank you, Ms. Milner, for being with us today and for sharing your personal experience with the committee and, of course, all of us across the country. So I'm going to proceed now to witness testimonies. So we'll begin with Ms. Moore. You may begin your testimony. Thank you.
Thank you, Senator Jackie Rosen, for having us here today. AARP, on behalf of our 38 million members, including over 300,000 members in Nevada and all older Americans nationwide, appreciates the opportunity to submit testimony on this important hearing of the Senate Aging Committee. AARP has been fighting for decades to make prescription drugs more affordable, which is why we push so hard for drug pricing provisions in the recently enacted Inflation Reduction Act of 2022. These new policies will go a long way to lower drug prices and out-of-pocket costs for older Nevadans. We thank Senator Rosen for her support of this law and the Senate Aging Committee for its recent hearings and other efforts to keep prescription drug pricing reform in the spotlight. For perspective on this historic nature of this new law, it is important to fully understand the difficulty that so many older Americans face in trying to afford the medications they need to stay healthy. On average, Medicare Part D enrollees take between 4 and 5 prescriptions per month, often for chronic conditions that will require treatment for the rest of their lives. At the same time, Medicare beneficiaries have a median annual income of just under $30,000. One quarter have less than $8,500 in savings. In Nevada, the average annual cost of prescription drug treatment increased 26.3% between 2015 and 2019, while the annual income for Nevada residents only increased 18.8%. This population simply does not have the resources to absorb the rapidly escalating prescription drug prices, and many are really facing reality of having to choose between their medications and rising prices of other basic needs such as housing or food. We know the number one reason someone does not fill a prescription is because of its cost. For years, prescription drug prices increases have dwarfed even the highest rates of general inflation. If consumer prices had risen as fast as drug prices over the last 15 years, gas would now cost $12.20 a gallon, and milk would be $13 a gallon. Just in January, the drug industry raised prices on over 800 prescription medications, just as they have increased prices for decades, including 3/4 of the top 100 drugs with the highest spending in Medicare Part D. After years of promises, Congress has enacted the historic changes in the Inflation Reduction Act. This new law will finally require Medicare to leverage its buying power and begin to negotiate with drug companies for lower prices. The provisions will apply to a growing number of drugs that are among the highest cost to consumers and Medicare, resulting in substantial savings for both seniors and taxpayers. The Congressional Budget Office estimates this policy alone will save Medicare nearly $100 billion over 10 years. The law will also give peace of mind to millions of seniors with high drug costs by capping their out-of-pocket Part D drug spending at $2,000 per year. There is currently no cap on these costs, and many Medicare beneficiaries simply do not have the financial resources to fill prescriptions that cost them $10,000 or more every year. The law also caps insulin copays in Part D at $35 a month, which will be a major help for the roughly 1 in 3 Medicare beneficiaries with diabetes. These are incredibly important policies that will not only save millions of Americans, but it will also save lives. The Inflation Reduction Act will also require drug companies to pay penalties if they raise their prices faster than inflation. This policy will address the long-standing practice of drug companies raising their prices year after year, often at more than twice the rate of inflation. This will help rein in seniors' out-of-pocket cost sharing and Medicare drug premiums. In addition, the Inflation Reduction Act will make available certain recommended vaccines for seniors on Medicare with no cost sharing, like the shingles vaccine that has a list price around $350. This policy already applies to Medicare Part B covered vaccines and a small group of private markets. But for years, Medicare beneficiaries have had to pay some level of cost sharing for Medicare Part D covered vaccines depending on their plan coverage. This will not only save seniors out-of-pocket costs, but is also an important preventative benefit to help older adults from illness. Approximately 4.1 million Medicare beneficiaries receive a vaccine covered under Part D in 2020. This new law is a historic victory for families across the country who are struggling to afford their prescriptions, but the fight isn't over. Big drug companies will spend millions trying to overturn or undermine the law so they can keep charging Americans the highest prices in the world. AARP will keep fighting big drug companies' out-of-control prices, and we won't back down. Thank you again to the Special Aging Committee for holding this hearing in Nevada, and to Senator Rosen for inviting us here to raise awareness about this critical issue. Thank you.
Thank you, Ms. Moore. We'll now turn to Dr. Madison. You may begin your testimony.
I first want to take a moment to thank Senator Rosen for hosting this committee meeting, focusing on an extremely important topic of prescription drug cost and how it impacts our Nevada seniors. Let me first take a moment to introduce myself. My name is Dr. Christina Madison. I'm a clinical pharmacist and an associate professor of pharmacy practice. I am also the founder and CEO of the Public Health Pharmacist, which is a consulting firm specifically focused on public health. I have been training the next generation of allied health professionals, including pharmacy students and pharmacy residents, as well as medical, physician assistant, and nurse practitioner students for the past 15 years. In my nearly 2-decade career, I have spent counseling patients on how to treat and prevent the spread of infectious diseases. And for the past 2 years, I have been working overtime on the COVID-19 response, providing vaccinations, testing, and treatment. I've personally facilitated the administration of over 12,000 doses of the COVID-19 vaccine, and now I'm helping to coordinate the monkeypox response through the increased access to vaccinations, which are currently in limited supply. My work over the years, and especially during the pandemic, has put a spotlight on the need to focus on health equity, which includes access to affordable prescription drugs. It is my honor and privilege to provide witness testimony as a public health advocate who has dedicated my professional career to caring for the underserved and vulnerable populations. I'm thrilled to be sitting here with you today following the recent passage and signage into law of the Inflation Reduction Act by President Biden on August 16th. This new law is an historic down payment on a deficit reduction to fight inflation, invest in domestic energy production and manufacturing, and will reduce carbon emissions by roughly 40% by 2030. More pertinent to this hearing is the fact that this law will also allow Medicare to negotiate for prescription drug prices and extend the expanded Affordable Care Act program for 3 years through 2025. Our country is on the verge of another health crisis, and seniors across Nevada are struggling with affordable care and coverage. Addressing health disparities and inequities is one of the main focuses of public health. And as a patient advocate, I know firsthand the importance of making sure patients have their basic needs met, which includes making sure that they have access to their medications by making them more affordable. Understanding that seniors, in particular those in the BIPOC community, our AAPI and Indigenous brothers and sisters, are facing more than just issues with their medications, but just getting to their doctor's visits in the first place, as well as structural racism and historic trauma. With most seniors taking multiple medications and having issues with polypharmacy, we know that several are having to make the difficult decision of paying rent, groceries, or gas before paying for their prescription medications. More and more are accessing food pantries and donations to supplement getting their basic needs met in order to afford their medications while living on fixed incomes. The passage of the Inflation Reduction Act of 2022 is going to make a meaningful and measurable difference in the lives of Nevadans. Nevada residents are being disproportionately impacted by high prescription drug prices. Per AARP, over 200,000 Nevadans have been diagnosed with diabetes. Almost 270 Nevadans have been diagnosed with either asthma or COPD, and over 230,000 Nevadans have been diagnosed with some form of cancer. These are 3 very expensive disease states that require chronic, high-cost prescription medications. For example, between the years 2015 and 2020, the price difference of these medications are as follows. Victoza, which is a very common treatment for diabetes, went from a little under $8,000 to over $11,000 per year. Another medication, Revlimid, used to treat some forms of cancer, went from $185,000 to over $260,000. Last but not least, Aspiriva HandiHaler, used to treat COPD, went from almost $4,000 per year to over $5,000 per year, just in a span of 5 years. We know that this represents a significant price increase that far exceeds normal increase due to inflation. These are just a couple of examples of the exorbitant drug costs that seniors are currently experiencing. As I work with nonprofits and community partners, I see that more and more people are accessing these types of social services in order to just deal with their everyday. Everything costs more, but that shouldn't include necessary life-saving medications. I've conducted many medication review sessions called brown bags events with seniors in the community. And I often see them holding on to medications because they don't know when they may need it again. This is that Depression era thought process. This is incredibly dangerous, especially if they get these older meds mixed up with the new medications. The first thing I do is I ask them what their medical conditions are, why they're taking each of their medications, and if they're taking them as directed. Oftentimes, there are at least a few that no longer have an indication or duplicitous medication and can be safely discarded. Ultimately, I know that this generation doesn't like to let things go because they're used to doing more with less because their meds are so expensive. This just is one of these things that they just don't want to let go of. Did you know that 20% of all medications are never picked up at a pharmacy? Typically because of lack of transportation, perceived need, and ultimately cost. Reducing the cost of prescription medications through the Inflation Reduction Act of 2022 is going to help not just the cost of prescription drugs, but people's quality of life because they will be able to afford other things. Medications don't work if you don't have them, and you can't take them if you can't afford them. That's why I am relieved that Congress just passed the Inflation Reduction Act, which will help lower costs for Nevada seniors, including for many of the patients I serve every day. This new law will be the first time that Medicare will be allowed to negotiate for lower drug prices in history. It will cap seniors' out-of-pocket spending at $2,000 per year and the price of insulin and other life-saving medications for thousands of Nevada seniors at just $35 per month. Thank you, Senator Rosen and the congressional Democrats for working to pass this legislation, which is critical and it's a lifeline to so many who live here in Las Vegas. I am providing this testimony to bring attention to these issues and to discuss solutions for our struggling Nevadans so that they can live healthier and happier lives. Thank you so much for the opportunity to speak with you today.
Thank you. Thank you, Dr. Madison, for your statement. We're going to proceed to Mr. Klein. Mr. Klein, you may now begin your testimony, please.
Thank you. On behalf of Nevada Senior Services and our aging community in Nevada, thank you for the opportunity to provide testimony to the Senate Aging Committee. I would be remiss if I did not thank Senator Rosen for this invitation to appear and for the Senator's steadfast support of Nevada seniors and all our older Nevadans. I'm also grateful to Senator Rosen, the Senate Special Committee on Aging, as well as other members of our congressional delegation, including Senator Cortez Masto, Representative Susie Lee, Stephen Horsford, and Dina Titus, for their support and passage of the Inflation Reduction Act of 22. I have the privilege to serve as the President and CEO of Nevada Senior Services, and then also as a board member of both the American Society on Aging and the National Association of Nutrition and Aging Services Programs. A trusted nonprofit leader in aging services for Southern Nevada, Nevada Senior Services provides a comprehensive range of quality programs and are designed to assist seniors and their family caregivers to live their best lives while aging in place. Our goal is providing remarkable care balanced with culture that supports autonomy, choice, and safety. We accomplish this by providing a no wrong door model of inclusive service delivery as the Aging and Disability Resource Center for most of Southern Nevada. We offer adult day health care, memory loss programs, case management, in-home respite and personal care, home repair and modifications, caregiver support programs, and hospital to home, which is a unique dementia-friendly care transitions program. This remarkable program has achieved a less than 1% hospital readmission rate. Nevada Senior Services serves over 2,500 seniors and their families every year. By way of example, hospital to home assists persons with complex health conditions, cognitive impairment, and those without home social supports to transition safely from the hospital to home without a readmission. Frequently, this requires immediate resourcing to ensure availability of critical medications, nutrition, follow-on medical care, and psychosocial supports for family caregivers. Nevada Senior Services has a long history of offering vaccine clinics for flu, pneumonia, shingles, and most recently COVID, reaching out to our most vulnerable seniors, family caregivers, and frontline staff. Our Nevada Care Connection Resource Center assists persons to connect to resources and to ongoing long-term services and supports such as medication, nutrition, housing, transportation, case management, and access to benefits, including Medicaid and SNAP. Last year, we provided over 3,500 critical resource connections to our citizens. Home Meds is our latest initiative, an evidence-based medication review for identifying potential medication-related problems in collaboration with pharmacists and physicians. It is designed to reduce the risk of medication errors and adverse effects, including unnecessary medication-related hospitalizations. This program targets seniors and persons with cognitive impairment, and it is made possible actually by a grant from the U.S. Department Administration for Community Living. Nevada's demographics and population characteristics make senior care in general and prescription medications critical issues to address. We continue to be one of the 3 states with the highest rate of growth in the over 65 population in the country, and 14.3% of our seniors live alone. Nearly 9 in 10 persons aged 65 or older currently taking prescription medicines, reporting that they take 4 or more prescription medicines. In addition, 1/4 of them report that it is difficult to afford their prescriptions, particularly those who are either in the fair or poor health status categories and whose income is below $30,000 annually and who take 4 or more prescriptions. 1/5 of our older adults report not taking their prescriptions as prescribed due to cost. Many seniors are poor reporters, not sharing their decisions about not taking their medications as prescribed with their prescriber. It is not an infrequent occurrence for seniors to admit making difficult choices between nutrition, housing, pet care, and taking their prescription medications. Polypharmacy is a significant risk factor for hospitalizations and falls, frequently resulting in hospitalizations. Medication-related issues associated with seniors and diabetes closely correlates with falls and with medication-related drug overdoses. The Inflation Reduction Act of 2022 makes an important down payment in addressing these prescription drug issues that impact the ability of older Americans to have their best possible lives aging in place with their family and friends. It accomplishes this by impacting a number of issues that have been longstanding priorities for our seniors. Nevada Senior Services, ASA, NANIS, and many local organizations serving our aging community. 3 of the priorities included in the legislation are the $2,000 cap on out-of-pocket costs for prescription drugs for those on Medicare beginning in 2025. It is estimated that over 1.8 million older adults spend more than that amount every year. No co-pays or cost sharing for vaccines covered solely under Medicare Part D beginning in 2023. Expanding the low-income subsidy, the LIS, to include beneficiaries with incomes up to 150% of the poverty line beginning in 2024. As members of this committee know, within Part D prescription drug programs, standard benefits is an initial $480 deductible before coverage even begins. For this is a high enough barrier to forego, purchase, and needed treatment for many of our seniors. The legislation allows for the first time in history for Medicare to negotiate for the price of drugs, unfortunately not till the beginning of 2026, and starting with just 10 drugs. It also caps copays for insulin for Medicare beneficiaries at $35 a month. As of 2024, those drugs with high costs enough to qualify for the program's catastrophic coverage would no longer have to pick up the 5% copay for each prescription. We have a duty to address these important issues associated with affordability and access to prescription medications. We must be committed to helping seniors manage their health span while their lifespan increases and while they stay engaged in life, maintaining their independence. We're grateful for the important work and contributions of the Senate Aging Committee in making these objectives more attainable. I thank the special committee for allowing me to speak today, and I'm very happy to take any questions.
Thank you so much, Mr. Klein, for your statement. And we will wrap up our witness remarks with Ms. Milner. Ms. Milner, please, you may begin.
Thank you, Rosen. Thank you and your staff so much for having me here today to share my experience with insulin and other expensive prescription drugs. My name is Regina Milner. I'm a 60-year-old type 1 diabetic patient, a patient advocate, a systemic lupus warrior, and a resident of Las Vegas, Nevada. I'm also a stiff person syndrome rare disease warrior, whom is SCAD65 seropositive, which has also caused my type 1 diabetes. That is a genetic disorder. That is it is 1 in a million chance and strikes 1 in a million people. However, most importantly, I am proudest of my titles of mother and grandmother. My children and grandchildren have witnessed my 20 plus years of struggling and consistently advocating for diagnoses, medications, and equitable medical care and treatment, all while navigating my way through an unfair and unequal systemic medical discrimination system. In the process of paying for my medical care and medication to try to maintain health as possible, my health as possible, I became completely indigent. And I now presently rely on my daughter, who also suffers from autoimmune disease, to provide me with a roof over my head and the care that I need. My many illnesses require me to use over 20 drugs, actually 27 drugs and medical supplies that include 2 specific brands of insulin, Tresiba and Humalog, which require prior authorization, as well as my Dexcom G6 device and glucose monitor. In addition, I take weekly injections of Benelista for my lupus and autoimmune diseases. I am now in need of IVIG treatment. The cost of maintaining my health isn't cheap. One of my lupus medications, Benelista, has a retail price of almost $5,000. It's thanks to my enrollment in the Medicare Part D Extra Help Program, which subsidizes my Benelista payment to under $10, that I can afford it. I also take insulin products and need insulin twice a day, but the products I use are not included in the formulary. During COVID, my glucose levels increased to over 700 while doctors' offices were closed, which is extremely dangerous and can result in diabetic coma. Unfortunately, my physicians didn't understand my genetic type of diabetes and told me that I did not need diabetes medications or insulin. The test results were repeatedly dismissed until I found myself sleeping into a coma. It took several weeks of more advocating for prior authorization to get the correct insulins that worked for my illnesses. I know all too well the dangers of not having access to the life-saving medications I need. My father, also deceased, suffered from the same illnesses. Senator Rosen, your advocacy and that of your Democratic colleagues is so much appreciated. The Inflation Reduction Act, which has just been signed into law last week, will cap out-of-pocket costs at $2,000 per year and cap insulin at $35 per month for people on Medicare, which is a life-changing amount for folks like me. Instead of rationing or skipping medications, seniors and others like me across the country can finally put their health first without being worried about the cost. Belated disease management and these exponential drug costs have cost me my quality of life. I have worked in many administrative roles. I used to type 90 words per minute. I now have a muscle disorder. I was also a game dealer for the Monte Carlo Resort and the casino on the Las Vegas Strip. I am a single parent, and I knew I had to make ends meet for my children, but the diseases I have made it impossible to keep a job. Capping the cost of prescription drugs, my muscle disorder is affecting my speech, will make a difference for so many Nevada seniors and so many other minorities and people who are struggling. I don't have a choice in the medications I take or the genetic diseases I was born with. But I do see a brighter future, especially with the passage of the Inflation Reduction Act and the cost of savings to come. I am losing my ability to verbalize myself clearly due to my muscle disorder and autoimmune disease. But my next statement is loud and clear. America's seniors have long needed prescription drug reform, and these out-of-pocket cost caps for many people on Medicare are the right step forward. I know that I am not alone in this struggle. There are so many of us who need our prescription drugs, especially in the autoimmune disease and chronically ill community. We can't afford to wait, but with the Inflation Reduction Act, thank God we won't have to. In closing, I am thankful to wake each day and begin each day with gratefulness, because it is by the grace of God that I am alive and standing before you today. In the process, I have had to fight for my life, and I have dealt with a lot of disparity that has resulted in me being misdiagnosed, receiving treatment that has endangered my health, and I have been barred from treatment that I should have received, unfortunately. I am so grateful that you have taken the time to listen to my story and have me here today. I thank you for all of your time and for listening to my medical experience. I know that other people are experiencing this as well, and I hope that I can be a help to them as well. Again, I sincerely and truly thank you, Senator Rosen, and all of your staff. They have been beautiful. They've been wonderful. This opportunity to share my story today, and for your hard work and the successes that you've accomplished to help us.
Well, Ms. Milner, you're the reason why we all do what we do. You're the reason why we're here today. Your strength and your bravery is people watching, people who know you. Your fight for those who don't quite have the strength, and we're so grateful that you're here. It's why we're here. It's why we're having the hearing, and I really, really appreciate you. And I think we'll get started on some questions. So if you need a drink, if you need anything from our team, you just let us know, Ms. Milner, okay? Okay, perfect. So why are we here? The high cost of prescription drugs, the new out-of-pocket spending cap. It's no secret that Americans pay far more for prescription drugs than people in other industrialized nations. And in fact, according to Rand Corporation, a recent report from the Rand Corporation, Americans pay more than 2.5 times more. 2.5 times more for the average prescription drugs than do citizens in 32 other developed countries. And that's when it comes to brand name drugs. When it comes to brand name drugs, Americans pay nearly 3.5 times more than our counterparts in other countries. Fortunately, President Biden just signed into law the Inflation Reduction Act, which congressional Democrats recently passed. All of our strong support, my strong support, and this new law, as we spoke about and you've heard, will soon cap the out-of-pocket costs for seniors on Medicare Part D at $2,000 per year total, no matter how many prescriptions they may take and no matter what those prescriptions are. You said people are on sometimes 20 different medications. There's a lot for people to navigate. And so, Ms. Miller, you said, how many prescription drugs do you take a month?
With my prescription drugs and supplies that I need, including my Dexcom G6, which I am so grateful for, it saves my life every day. I take 27 prescriptions.
And you're enrolled in the Medicare Part D Extra Help Program, which helps you subsidize those costs?
Yes, ma'am, and I'm so grateful. I just began using it this month, and the SHIP program has been so helpful to me in helping me to get enrolled and to understand Medicare. It's been a new education.
And if you didn't have this program, how much would you spend if you just had to pay for it? Do you know?
They are still, at this point, itemizing the total cost of my drugs with my new
Right.
Part D. But at this point, it looks like I would be well over $15,000 per
A
month.
year.
Because
Per
my
month.
Benalista is
Per month.
5,000 by itself per month.
And so if you're estimating about $15,000 a month, and we're going to put in a $2,000 a year cap, that's just about $167 a month. I don't know, maybe you could sum that up in a sentence or two, how that's going to change your life?
I thank God. I am so grateful because every morning that I wake up is a blessing and I can take my medication. I can still think clearly and still navigate and still advocate for myself. Being able to have my medication is a blessing. Being able to have your help, all of your help, is a blessing. I'm so thankful and grateful. That's all I can say is thank you.
Well,
Thank God.
it's coming. The help is coming. And so we're going to talk now a little bit about Medicare price negotiation, because that's really going to make a huge difference, because one of the core components of the Inflation Reduction Act, again, I'm so proud to help pass that. We finally made it possible for Medicare to negotiate directly with big pharmaceutical manufacturers to ensure the lowest possible drug prices for our seniors. And so over the next few years, the Department of Health and Human Services will be allowed to negotiate the prices of the most expensive drugs on the market to help lower costs for seniors in Nevada and across the country. Many of the most expensive drugs, which often have limited or no competition, are for serious conditions like cancer. And I'm going to repeat the statistics for Nevada. So cancer impacts more than 230,000 Nevadans. My mother died of lung cancer. I was one of those Nevadans that it impacted my family. Diabetes, it impacts more than 202,000 Nevadans. And asthma, which affects more than 260,000 Nevadans. And so I'm pleased that as a result of this new law, again, I can't reiterate enough, Medicare is finally going to be able to use its purchasing power to deliver those lower costs for seniors who rely, like Ms. Milner, on the life-saving medication. So, Ms. Moore, we're going to talk about AARP Nevada. You have just been a longtime advocate for Medicare drug price negotiation. And can you just maybe give a few more words about not just how hard you work, but how you've come to this point? The Inflation Reduction Act, you were a champion. AARP is a champion for it, how it's going to help millions of Nevada, millions of seniors across the country. Nevada seniors, of course, keep our prescription drug prices down.
Thank you, Senator Rosen. And as you stated, AARP has made the argument for many years, for decades, that with more than 50 million Americans getting their medications through Medicare, if the program was allowed to negotiate prices, the power of those numbers would deal a much better deal for Medicare beneficiaries and for taxpayers who ultimately foot the bill for the lion's share of the medication costs. And after decades of pushing for this reform, the Inflation Reduction Act finally authorizes Health and Human Services Secretary to begin negotiating the prices of 10 of the highest cost medications and prescription drugs in 2023. And the negotiated prices will go into effect in 2026 for Part D medications and in 2028 for drugs covered under Medicare Part B. The number of drugs whose prices will be negotiated on behalf of Medicare will increase in subsequent years, and by 2029, a total of 60 drugs will be subject to a negotiated prices. Overall, this process will create substantial savings for seniors and taxpayers by reducing the prices of the growing number of expensive and widely used prescription drugs. The Congressional Budget Office estimates that this program will save Medicare approximately $100 billion in 10 years. And according to the Kaiser Family Foundation report, Medicare negotiation could actually drive down prices for drugs used by 8.5 million people on Medicare, accounting for nearly 1 in 5, 18% of the 47.7 million Medicare Part D enrollees in 2019.
Thank you. I think we all know that an ounce of prevention worth a pound of cure. So by providing these medications, we can keep people healthier, happier, better for their families, of course, for their pocketbooks. They don't have to make choices. And most importantly, we can keep them away from the most expensive care, which is obviously going to the hospital. And so, Mr. Klein, I'm going to turn to you because I would say not many, but I would say probably all of the seniors that you serve are on Medicare, right? And so this Medicare negotiation provisions, being sure that people get their medication and they stay healthier, they don't have to make the choices, maybe they're not entering the emergency room. How do you think it's going to impact the work that you do and others like you?
We're very excited about the prospect. This has been a long time coming. As Senator knows, the VA's been at this for forever. So is the Department of Defense. Every managed care organization negotiates prices for drugs. The people who have really been on the raw end of this problem are those people frequently who just above the poverty line, seniors on fixed incomes, and without a controlled drug costs, making those big decisions between food, pets, and life. Every day we go through the process of trying to find resourcing for people to get medication because they have a plan that they can't afford. They can't afford another plan. The alternatives leave them the cost too high. And so they're constantly making major health choices. This is the cavalry coming for those people on fixed incomes. And while it may not affect everybody tomorrow, it will over time. And with an aging population, folks who are going to live into their 80s, maybe 90s, the long haul here is really important. So we think this is going to have a big impact day to day. In the short run, we think it's going to create some incentives and opportunities for us to look at alternative medication funding mechanisms to try to help people on fixed incomes kind of span the time while they wait for this to really hit home.
That's fantastic. We know that people living with chronic disease, we live better and longer, and that medication is what's helping that. And I'm sure you work with many grandparents, so those grandkids are the true beneficiaries, perhaps, of getting to know their grandparents. But we're going to turn next to you, Dr. Madison, because nobody knows better than you than high prescription drug, the costs, the impacts on patient health outcomes, compliance, and their healthcare providers, you being one of them. Unfortunately, we've far too often seen that the high cost of prescription drugs, well, it impacts both the seniors who need them and also the healthcare providers who manage their care. Doctors, pharmacists, other healthcare professionals. Well, you didn't go into this not to help people. You went into this business to make a difference, to save people's lives and help them. But when it comes to prescribing or recommending treatments, you can only do your job. Everyone can only do their job if patients don't face those insurmountable financial barriers. And for many seniors, there are barriers for each and every one of their prescriptions. Think about Ms. Milner. Again, according to Aarp, the average older American takes roughly 5 prescriptions a month, typically on a chronic basis to treat conditions like we've talked about: cancer, asthma, COPD, diabetes, heart disease, and others. And shockingly, the average annual list price for one brand name drug used on a chronic basis was over $6,600 in 2020, which is more than 1/3 of the average senior's Social Security retirement benefit. Think about that. More than 1/3 of your yearly income just spent on one brand name prescription drug. Even existing Medicare Part D coverage can't always make that affordable for most seniors. So, Dr. Madison, I'm going to turn to you as a clinical pharmacist. I know how deeply and passionately you care about this. You've been involved in assessing both patients' health needs and their medication evaluation, if you've spoken to, and their management. So can you tell us about the times when you've recommended medications to your patients that you know that are appropriate and effective, the best medication, but had to instead suggest something perhaps less effective or less beneficial because the patient simply couldn't afford the choice?
Absolutely. So one of the first things that I was thinking of when I was thinking of this question was, our lovely advocate over here, Miss Milner, and really the high cost of diabetes. So there have been amazing innovations in diabetes therapeutics over the past, really just the past 5 years, and seeing a lot of these newer medications that are injectable therapies that are taken maybe once a day, but they're quite expensive. So, knowing that someone could benefit from an injectable long-acting medication and not being able to receive it, having to use things like oral medications that are taken multiple times a day, which we know directly impacts an individual's ability to remember taking their medication. We're talking about seniors. Exactly. So the more we can simplify their regimen, the more likely they are to get the most benefit from their therapy. And so many times we've had to recommend a generic or something that is more likely to impact their kidneys or their bones or their eyesight. I was so touched by Ms. Milner's testimony, and I see so many of the patients that I've worked with over the years in her. And even just thinking about my own grandmother who passed during the beginning of the pandemic and thinking about her care and, having dementia and not understanding, all of the different things that she needed and caregiving and making those decisions when you get to that, twilight of our lives. It's really impactful, the work that you're doing, the work of Congress. And I'm so excited to see the improvement in quality of life that our seniors are going to have. And not just that, but our economy. Because think about it. If people don't have to worry about affording their medications, they're more likely to engage in doing and going out and spending money and being consumers. So it's not just about the amount of life, but the quality of life that our seniors can live.
You want the best patient outcome. And you
Absolutely.
answered some of my other questions, but you didn't answer. I want you to talk more about the hoops that you may have to go through as a medical provider. If you know that there's a good medication out there that's really going to make a difference, to try to get that financial assistance for your patients. Tell me about that.
So there's a couple of different things that we can do. Obviously, there are certain manufacturers that have copay assistance cards, so that's very helpful, but not every pharmacy has the time to be able to go through and do that, and so that can be a little bit challenging. And then also, if you're having an issue with receiving your medication, there may be some things about, delivery. As I mentioned before, 20% of prescriptions are abandoned, usually because they can't access them or they can't afford them. Right. And so if transportation is issue, being able to deliver the medication to the patient's home is extremely impactful. And then not being able to provide them with the best medication has other possible side effects. So it's not as good. So the medical condition that they have may not be treated to the best of its ability, but then they may also be more likely to experience side effects from the medication as well. And so those are the things that we really want to try to avoid. And unfortunately, the hoops that we have to jump through are prior authorizations, things not being on a formulary, going and negotiating with the managed care offices because they put certain things on because they got it because there was 2 or 3 other medications that manufacturer also made, and they made a bundle and they said, okay, we're going to put all of these medications on the formulary. And unfortunately, the rhyme and reason of that is not something that the average senior understands. They just understand that they're not able to access the best medication. And it's really hard.
A lot of your time jumping through hoops when you could be actually dealing with patients. And so that takes away your time for being able to do direct care.
Absolutely.
I have one more question for you. Well, we have a bunch more to go through, but I was a caregiver for my parents and in-laws as they age, so I understand that aspect. But have you seen the high cost of prescription drugs? How does it impact the caregivers who take care of your patients? Maybe if people aren't able to get the best medication, or they're having to ration, or whatever you're seeing.
Well, we're seeing people consolidate households. We're seeing people dipping into the savings, if they even have savings. You know, if we're living paycheck to paycheck, they're going to social services, they're accessing food pantries, they're accessing assistance programs, you know, Meals on Wheels, dining with dignity, all these different things that, you know, I'm seeing people that ordinarily wouldn't access those services or are coming but are reluctant because they feel embarrassed or they feel like they don't understand how they got into this situation. And they're so thankful when they come and receive donations, clothing. You know, some people lost their jobs during the pandemic and lost everything. And so the caregivers of people who have chronic medical conditions, they need a respite as well. And so you see a lot of stress, anxiety, depression in those caregivers because they're internalizing the hurt and the pain that the people that they're taking care of are experiencing.
Giving people their medication at affordable prices creates a better community for everyone,
It
I guess, is
impacts
the
so
bottom
many
line
things.
right there. Well, we're going to talk a little bit specifically about diabetes now for a minute, because currently more than 375,000 Nevada seniors receive prescription drug coverage through Medicare Part D. And over a quarter of them, more than 93,000 Nevada seniors, have diabetes. So across the U.S. in 2020, Part D enrollees spent a total of, and this is $1 billion on out-of-pocket on insulin. That's an average of $54 per insulin prescription. For many Nevada seniors living on that fixed income, $54 for each insulin prescription, we know it's just not affordable. So despite being a life-saving drug, many seniors, including, as we've heard today, you, Ms. Milner, are forced to sometimes ration your insulin, or you simply don't buy it at all. But again, we're proud to report help's on the way thanks to the Inflation Reduction Act. So beginning next year, it'll be here before we know it, the cost of insulin will be capped at $35 a month for Medicare beneficiaries, not just here across the country. And so $35 insulin. I know you take 27 medications, but just tell me how that feels to you, just that one change.
That one change makes me feel so relieved because, as I stated, as Dr. Madison understands, it isn't on the formulary. I had to go through many hoops, hurdles, in order to have my physicians do the prior authorizations, dealing with MCOs, who in prior authorization departments that sometimes don't understand how important it is, because other medications, insulins can make you very ill, as it did with me. And so having that relief is just a burden that I feel is just, I can breathe. It's gone.
It's going to help the rest of your
Yes.
medical condition just to have
It
that
does,
stress
because
removed.
when your glucose is not right, nothing is
That's
right.
right.
Nothing feels good. It is the worst feeling in the world. So it is a total relief, just that drug alone, knowing that $35, oh my God. I mean, again, only word I can use is grateful. And regardless of how ill I am, for me, the solution is to wake up every day and be grateful for all that I do have, for the people that have helped me, the people who have sacrificed for me. I'm grateful, and I'm grateful for you and you and you. For everyone, I'm grateful.
We're grateful
so
for you too, and
It's a godsend.
we're proud to do this work. And so I'm going to turn over to Ms. Moore in AARP because this is just one story. I probably could have 1,000 people here and you would hear a similar story about their struggles, about the relief they'll feel when just this one burden is off of their mind. And you represent over 320,000 Nevada seniors. And so tell me, I know we're hearing from one, but you can speak on behalf of them. What do you think, if you just want to think about the emotional relief or what that might mean to people, just give your impression. If you can consolidate 325,000 seniors into a couple of sentences, what do you think just that one change means?
Like Ms. Milner, she is one of many stories. We know that many families across Nevada and across the country really are struggling with the outrageous prices of insulin. And really, people needed to stay alive and healthy. That's the bottom line. It's just one tragic example of the larger problem we've heard from Dr. Madison of the drug industry that affects so many different medications. And thankfully, the $35 monthly cap for insulin in Medicare that Aarp supported will affect very soon. Like you said, 2023 is right around the corner. And Part D plans will require to offer this copay amount even before the enrollee meets the deductible for the year. So people will see the copay changes at the beginning of the year. And Aarp would welcome the chance to extend this cap to others beyond Medicare as well, whether it be at state or federal level. Aarp offices across the U.S. have been active in the state legislators and across the country, as I said, for over the past few years, to pass insulin copays in state laws that would apply to private insurance. So Aarp will keep fighting for Americans 50 plus and for all so that they can afford their medications.
Thank you. So, Mr. Klein, I know you work with so many seniors, and you're going to be able to maybe put some of your financial resources or some of the magic that you do to help those thousands of seniors every year. Give me a little, from your perspective, $35 insulin. How's it going to help your team, help others, and what's the impact on what you do?
It's a huge boost. First of all, it's going to be a boost to the team. Folks who work in the trenches take this seriously.
Right.
It weighs on them every day. Every time somebody comes through the door, a patient comes through the door who needs help, and you don't have a resource, it's a failure in the minds of the people who are attempting to take care of them and help them. This is the cavalry coming. So first of all, it's hope. And hope is really important in this population. It's almost more important than the immediate to know that
Give you
something
a
is
boost.
coming. It gives you a boost. It tells you that there's an opportunity to impact it. Second, for this particular population, our staff are constantly looking for resources, attempting to find other not-for-profits who might have a medication program that we could pair with, well, if we can lower the cost, can we fill in the blank to help them get coverage for the short period of time that might be to bridge between programs or to wait for something larger to come along. So this is major news. It's major news not only for the senior, but importantly, it's major news for caregivers who've really been struggling with this and who take it home with them every night.
We'll be able to put those resources to some other benefits. So, Dr. Madison, from the medical perspective, we know the impact it's going to have. So just tell us the impact if people take their medications regularly, on time, at the right dose. Tell me how you're feeling about that.
Yes, the 3 R's, right? Right drug, right time, and the right way.
See, there you go. I didn't even, I just
I always tell people the 3 R's. So, I mean, it's incredible, right? Obviously, we're talking a lot about about diabetes because it impacts so many individuals. But really, these concepts and these these interventions go across any chronic medical condition. And so for me, my biggest thing when I talk to my patients is, do you feel better, worse, or the same? And if it's the same or worse, then I need to think, what's going on? Is the medication that you're taking appropriate? If it's not, how can we fix it? And so having the ability to be able to take your medication the right time and the right way, and the way that it was intended by your healthcare professional, by your physician, by your nurse practitioner, by your physician assistant, right? It's so critical, because when you start getting between that relationship, now you've messed things up. And the intended purpose of that medication goes away, because now the patient can no longer be adherent, because the medication only works if you can take it, and you can't take it if you don't afford it. And so this is incredible. I think just looking at, chronic disease management, there's so many ripple effects that will go towards this. If you are able to be healthier because you're able to take your medications, you're going to be a more productive member of society. You're going to be able to do more things. You may start a small business. There are so many different things that you could do. As a senior, you may be able to take care of your grandkids that you maybe weren't able to before, and that could help the family.
Long walks
And then
improve your health.
you can potentially help your children so that they don't have the burden of childcare. There's so many ripple effects that this can help with, just by simply making sure people can take their medication.
Thank you. Well, we're going to talk about some other prescription drugs now, because this is just one of them, the first one that's going to hit right away, no deductible. It's going to be so impactful. But we're going to put caps on price increases for drugs under Part D, because we've discussed today Nevada seniors, including those with Medicare Part D insurance coverage. Well, it goes without saying they're paying far too much for their prescription drugs, and drug manufacturers have continued to raise prices at unsustainable rates. And so, in fact, according to a recent Kaiser Family Foundation study, half of all Part D covered drugs had price increases greater than the rate of inflation in 2020. Greater than the rate of inflation in 2020. This is just unacceptable. And it's one of the reasons why Democrats in Congress, why we did pass the Inflation Reduction Act. And so we're going to talk a little bit more about the law. Starting next year, this new law will require manufacturers that raise the prices of drugs faster than inflation to pay rebates back to Medicare. This way, drug companies will either need to keep prices affordable, in line with actual increases in the cost to make them, or have to pay a rebate to Medicare. Either way, seniors win. So I want seniors across Nevada and across the country to hear us loud and clear. This new law will bring relief to seniors by lowering their expensive drug costs. So, Ms. Milner, I know we're gonna keep going around the table, but you take a lot of medications. And so you've had some of them that have gone up and up and up. And so I'm going to ask you, from your perspective, not just the cost, we know they're unaffordable, but what's the emotional burden when you see the drug go up so high year after year?
It's an insurmountable emotional burden, because, as you have all stated, it is a domino effect. It affects not just me, but my family. I think, wow, I've got 3 grandsons. I want to still be able to get down on the floor and play race cars with my grandsons. And I can't do that if I can't afford my drugs. However, I have noticed, and I want to say, since I am on the right diabetes medication, I can afford to eat right. And when I can afford to eat right, God bless me, I take less diabetes medication, less insulin. And it makes me feel so good, because then I have more energy, I'm more cognizant, I can just do better all the way around. So it means the world to me. It really does. I mean, I think that if we have more people who could help others who are in the situation advocate for themselves, they would be a whole lot healthier. I mean, just understanding that, yes, you have to take your medication, but you also have to eat right.
And that costs money. So now you spend less money on your medication. You can eat healthier.
I can afford to buy the vegetables I need.
That's right.
And eat right and keep my glucose at a level that it should be. And it really matters. So
That's fantastic. Well, Ms. Moore, I keep turning to you because you get to represent all the seniors in Nevada. And so on a bigger note, what do you hear from Nevada AARP members about the drug manufacturers just raising these highly inflated costs well over the rate of inflation? What do you hear from your AARP members about this?
Senator Rosen, the rising prices of prescription drug prices, that is the number one of the things that we hear most from our members. It's no secret. So we hear your stories every day. In the years leading up to the passage of the Inflation Reduction Act, 37,724 Nevadans signed ARP petitions calling on Congress to take action to reduce drug prices. I know that the senator got many of our emails, letters, texts, just about every day. We were relentless. It was truly tragic when an older person fixed income has to choose, like you said, between essentials like food and rent and the medications that they need to keep themselves healthy. It is a ripple effect. And when the prices of those drugs are increasing at often much higher than the rate of inflation, there's simply no way for these seniors to keep up. You just can't. It's also important to keep in mind that these increases are on the top of sometimes decades of annual price increases. And those price increases add up over time.
Thank you. And I want to say I'm grateful for the AARP partnership. Those emails helped, and those letters and those calls and all the conversations we had. Honestly, I carry those stories with me. I retell those stories. So I am grateful for that partnership. And Mr. Klein, I guess the same thing to you, because you see different. We have a patient, you talk about all the seniors, you have a lot of boots on the ground. Again, we're going to try to get those, it may go up, but only to the rate of inflation.
Cost escalation for people on fixed incomes, and many seniors are just that, people on fixed incomes. And we can't forget that many of our seniors are taking care of even older parents, taking care of a spouse, taking care of a child, and frequently taking care of grandchildren in today's world. So you take someone who's on a fixed income, who's also caregiving for a wider group, and then you apply cost escalations that force them to make choices. And those choices are serious. They're not just choices about themselves and what they do for themselves, but they're in effect choices of what they make for their entire caregiving unit.
That's right.
And at the end of the day, some people end up in nursing homes when that cost gets to be too great for them to bear. The consequences of high escalation in pharmacy costs really bring those costs home to bear. So this is, as I mentioned earlier, this really is in many respects the cavalry. This is putting a lid on just how much burden some of these families will have to absorb. And also we think it will also put a lid on some of the other problems that these choices make. So, to Regina's comment about nutrition, when you have to make a choice between good nutrition and a medication, you can't win in that choice.
That's right.
So putting a lid on it, creating certainty is really critical. And I think this has been an amazing and important accomplishment.
Well, and I think to your point, whether it's a multi-generational household, like Ms. Milner's, or whether they're the seniors who are living independently on their own, we want to keep them there. We want to keep them from moving, if we can, to a nursing home or some of those, and keep them either independent or with their family where it's much better. I'm going to just ask you, doctor, as a provider, now again, you're looking to provide a medication or multiple medications. So knowing that this isn't going to go up exponentially, how do you feel as a provider when you walk in the room and you are going to have to talk to a patient?
Incredible. That's the best way to say it. Incredible. When you look at a patient's face, when you tell them the cost of a medication and you see sort of the life drain from their face and the emotion change, it's devastating. And to know that these prices will be capped and that now they don't have to make those difficult choices between their basic needs being met and their life-saving medications is just incredible. I can't think of a better word other than that to say it. And
it's
really
going to remove
just
stress and burden from providers because you don't want to go in with the disappointing news. So that's going to make your ability to care for patients so much better.
not to mention the fact that as a provider, you take those stories home too.
Right.
And so I think it helps everyone. It's not, I think about many times where I just think about just recently where I was helping out at an advocacy agency and we were giving out food to seniors. And a woman drove up and we were walking over to start helping out and she was turned away because they were closed at that time. But because of a language barrier, she didn't realize that they were just closed for lunch and not closed for good.
Oh.
And so she had asked me earlier, like I was walking over in the parking lot and she asked me where to go. And so when I told her, I knew she was there for the food assistance. And so as I saw her about to leave, I noticed she didn't have the food in her hands. And I said, ma'am, is there anything else I can help you with? And she said, oh, no. They said that they're closed. And I said, oh, they're just closed for lunch.
Oh.
Can you wait like another, like maybe 20 minutes and they'll open up again? And she said, oh, yes, thank you.
So her face lit up.
So
Right.
very like sense of relief. And then about an hour later, we went back to help give out the food and she came back. And I was so happy to see her because, it was just the difference of better communication. But I was just thinking like how many other people in her house that she was feeding that were depending on that food.
So the ripple positive effects in advocating for people. And so that leads me directly into my next question, which is really advocating for patients in need. And of course, all of you advocates. But Mr. Klein, I'm so incredibly proud of the work that Nevada Senior Services does to help educate, advocate for seniors who need help finding health care, finding resources, navigating complex agencies, trying to do those home modifications sometimes you may need in the bathtub, the bathroom, getting, whatever those things are so you can age safely in place. And services, they're just so important. Nevada's senior population is growing so quickly. Between 2011 and 2018, Nevada's population aged 65 and older increased by 40%. I think that puts us in one of the faster growing states, I might say. And the population of Nevadans aged 85 and older increased by 25%. That's double the national rate. And so one of the programs you do, one that particularly stands out to me, is your comprehensive geriatric assessment program. And you bring together a team of medical and social service professionals to examine that patient's overall well-being. And that, of course, includes prescription medication review and management. So can you just talk to us a little bit or walk us through the comprehensive geriatric assessment process, and in particular, you're going to hopefully have a little bit of help with the Inflation Reduction Act, but how you help them navigate the cost of the prescription drugs, which is why we're here today.
We're very proud of that program. It was the first in Nevada. I'd love to say it was the first in America, but I actually opened one of these in 1972 in Philadelphia, which was actually the idea of one of our medical directors at a hospital I was working at. So I've carried it with me.
That's a good thing to carry.
It was. And when we created it in Nevada, we created it as a collaboration. So we have a board-certified physician in geriatrics who comes to us from Truro. We have geriatric pharmacy help who comes to us from Roseman. We have our own geriatric nurses, our social workers, occupational therapy that also comes from Truro. And that team gets together and spends about 3 hours examining the records and the history of the person who's coming to them, usually with their family caregiver, and then doing an in-person exam, team exam of the patient to try to get at the root of all the complex problems people have, some of which are purely medical, but most of which are combinations of complex issues that include family caregiving issues and always medication issues.
Right.
It is not unusual for us to find people on drugs that they shouldn't be on in the first place. They're contraindicated for seniors. Happens all the time. And we're in a position then to go back to their physicians and their primary care physicians and say, well, you might want to think about some alternatives. And it's not unlikely that we get that story of the person that says sheepishly, well, I haven't been taking this one or that one because. And inevitably the because is dollars. And so one of the people in the room is a navigator, a social worker who's got real skills in navigating where opportunities for reimbursement and other financial supports are, and they go to work. Nobody leaves there without their medications.
Right.
Nobody leaves there without a resource for medications. Nobody leaves there without the opportunity to get follow-up from the team. And so it works well, and it works as a family endeavor of not only the whole healthcare team, but the family caregiver in conjunction with the person who's receiving services.
It seems like this great overall comprehensive project and group, and I think that is what gives you so much success. Well, we're going to move on to our last question, and something that we've been thinking about. Well, we always think about this, but because of COVID-19, it's really been on the forefront of everyone's mind, which is vaccinations. And of course, for seniors, there's quite a few vaccinations that they can take to help improve their lives and keep them disease-free. And so free vaccinations for seniors on Medicare Part D. So Dr. Madison, many of the senior patients you see, I hope they have the Part D plans, and therefore almost 500,000 Medicare eligible individuals in Nevada, 15% of our population actually has Part D. And in rural counties, have a higher percentage per capita of Medicare beneficiaries, with Mineral, Nye, and Douglas counties Medicare eligible populations currently over 30% of their total populations. So thousands of Nevada seniors who could benefit again from reduced health care costs, from the Inflation Reduction Act, because we're going to establish zero cost sharing for vaccines for seniors on Medicare Part D starting in January. Zero cost sharing. This is what the Inflation Reduction Act is doing. So it's especially important relief. Some of these diseases, I know there's pneumonia and shingles. You could probably tell me all the ones there are, but some of these vaccines, like shingles, we talked about the price is so expensive. So can you tell me, Dr. Madison, how you think the Inflation Reduction Act's free vaccine provisions, how that's going to make a difference for the population that you serve? And what are the healthcare consequences of seniors foregoing these vaccines?
So first and foremost, I want to say public health is obviously my focus. And, vaccinations are literally the single most effective public health intervention in modern medicine, right? That's how we were able to get rid of smallpox and up until about a month ago, polio. right? And so it's so important for us to be able to provide these preventative care measures, in particular to seniors, because these vaccine preventable diseases can be devastating to seniors. When we think about hospitalizations, especially when we think about things like influenza, that 36,000 individuals per year being hospitals and potentially passing away is usually from the secondary bacterial pneumonia that they get after getting the flu. And so when we can provide things like pneumococcal vaccination, influenza vaccination, it helps to not only keep those seniors healthy, but out of the hospital, which again creates more healthcare cost and more burden on themselves and their families and their communities. And so this is extraordinary that they will be able to provide these vaccinations at no cost to seniors. And I just think about individuals who've suffered from shingles. If anybody has known anyone who's had shingles, it is something I would not wish on my worst enemy. And now that the ACIP, which is the Advisory Committee on Immunization Practices, has now recommended it now all the way down to the age of 19, there are now people who can get it that have autoimmune diseases that are more at risk because their immune system is suppressed, and it puts them more at risk for getting things like shingles. So extraordinary, incredible. Can't think of any more, fantastical words that I can use, but just so great that we can provide these vaccination, life-saving, life-changing vaccinations to seniors.
So, Mr. Klein, all these vaccinations are going to be free. So how are you going to be sure that you get the word out to all the seniors, even more working with your partner agencies, every senior in Nevada that who wants one can get one free of charge due to the Inflation Reduction Act?
Advocacy, advocacy, advocacy. We're really proud. We've been running vaccine clinics for as long as I can remember. It started with flu and pneumonia, and the latest flu vaccine comes out, the latest pneumonia vaccine comes out. We try to get the word out into the community. Importantly, we work with a network of other not-for-profits. So organizations like Helping Hands, so folks who deliver food, folks who have food pantries. We get the word out, we collaborate, we try to reach the people who are hard to reach, those seniors who are not out and about as much, and to encourage them to come out. And then we follow up with them because they can't get all their shots at one time. So we have to run a second clinic, and then we say, gee, we're glad you got your pneumonia shot, but it's time you get your COVID booster, or it's time for you to get your flu shot. And so we have a pretty aggressive, in a most positive way, loving way we can make it, line of encouragement with our partners all over Southern Nevada. And then we run programs, and we provide food. We provide education. We try to do things to encourage folks who otherwise can't get out. And those who can't get out, who are homebound, we send somebody to them.
That's fantastic. So you're going to get the last question, because speaking of advocacy, AARP, really you're the big umbrella organization looking at all of these things. And so how are you going to help everyone here today be sure that the word gets out to every senior in Nevada, rural and urban, regardless of the language that they speak, that they have access to free vaccines starting next year?
We have a saying at AARP that says, what we do for one, we do for all. It's our founders. I feel it's my favorite quote from her. The free vaccines under Medicare, as Dr. Madison said, there's only one word for it: incredible. Incredible, and very soon. So for this benefit and all benefits of this historic law, we are certainly going to plan major public education and outreach and push various articles. We have our comms director here with us today, ensuring that folks know where to go for the best information. And we will be producing videos. We'll be doing lots on our website. That's, it's not only for our members, but really anyone can access that information. We want our members and the public to have a clear sense of what this, what is expected and what's to come in this new law. And we welcome the work of our members of Congress. We know we work really well with you, Senator Rosen, and we know that that will continue, or really any other stakeholders we work with. Jeff, very well, and other not-for-profits, nonprofits, and community partners, because we want to keep a focus on this issue. We want to help educate the public about the prescription drug provision in the Inflation Reduction Act. Our work is not done.
Well, and you have a partner in me, and I know that you have a partner with everyone here, and of course, the rest of the Democratic federal delegation. And so I can't thank you all enough for being here, for contributing your time, your expertise, your emotions, your passion, all of it. It means so much to so many. And of course, I want to thank the College of Southern Nevada for giving us this wonderful space to do this in. And because you know what? In a country as prosperous as ours, we should do better. We should always do better, especially for our seniors. And no senior, as we've spoken about, should be forced to choose between paying for life-saving medication or keeping their lights on. No senior should have to choose between affording their insulin or putting food on the table. And no senior should be expected to spend nearly all of their Social Security check on the prescription drugs they need just to live their everyday lives. Unfortunately, as our witnesses have testified today, this is far too often the case in Nevada and across the country. We can and we must do better. And now, thanks to action in Congress, we are going to do better. And I'm proud again to say that Democrats in Congress, well, we've been listening to Nevadans and to the American people. We've taken your stories, these stories here today, and those you represent, back to Washington, and we enacted bold, historic legislation in the Inflation Reduction Act, legislation I am proud to have voted for that will finally lower prescription drug costs. And as we've heard today, I'm going to reiterate all of this. This new law will do just this. Finally allow Medicare to negotiate for the best price of prescription drugs. Finally, cap seniors' Part D out-of-pocket spending at $2,000 per year. Finally, cap seniors' insulin costs at $35 per month. Finally, cap prescription drug price increases to no greater than the rate of inflation. And finally, increase Medicare subsidies for lower-income Americans. We're going to do even a little bit more. We're going to ensure that all seniors receive all their vaccines at $0 cost sharing, free. And we're going to reduce burdens on those healthcare providers like Dr. Madison and others, and the caregivers, those angels in our family and those that work with us, by delivering lower costs for seniors across the board. And I'm so proud of the work my Democratic colleagues and I have done to lower these costs for seniors, to protect and to expand Medicare. But I want everyone to know this is just the beginning. Moving forward, I will continue to fight to protect Medicare, to reduce healthcare and prescription drug costs for Nevada seniors, and I will continue to work with all my colleagues to make Medicare even stronger for years to come. Now, our closing business. If any senators not in attendance today have additional questions for these witnesses, any statements you'd like to add for the record, the hearing record will be kept open for 7 days until next Tuesday, August 30th. With that, thank you all again for participating, and this concludes today's hearing.